As we deal with these unparalleled times due to the COVID-19 pandemic, I had the opportunity to sit down and talk with Dr. Robert Freelove, Chief Medical Officer at Salina Regional Health Center. We talked about the COVID-19 pandemic and how Salina Regional Health Center is working to ensure the safety of our patients and community. Dr. Freelove, thank you so much for being on the show. I know situations are really changing daily, but what is the situation, at least locally, for COVID-19?
Yeah, well, here in Salina County, we've seen 15 cases. We continue to test every day. We've actually loosened up some of the criteria for who gets tested. We're trying to maybe test a few more people, see what's out there. We have tested over 250 individuals here in Salina County.
Okay.
And the fact that we only have 15 positive so far is good evidence that the social distancing and some of the other social interventions that have been put in place are actually working to help flatten that curve. And I need to thank the community for doing that. I know that's a bit onerous on people, and they've made quite a sacrifice to do that. But it has allowed us to prepare here at the hospital. We've taken that time the last several weeks to put in several plans and do things to keep our patients and our staff safe so that we can take care of as many people as possible. We've done some things like taking some rooms that were being used for rehab and some of the older part of the hospital that used to be used for patient care. We've kind of pulled those back into service and created some units specifically for patients with COVID-19. A lot of those rooms we've added negative pressure capabilities so that, again, that moves air through the door and then out of the room, keeping anything in the room to help protect patients and staff. And we've done a lot of other things with trying to collect PPE and build up our stores so that we have the adequate safety materials in place and practices in place for when or if we do see a surge in patients.
I know just because COVID-19 is among us doesn't mean other health issues go away. What do you suggest for people to do, and what are some of the things that the hospital and the clinics are doing?
Yeah, I'm glad you asked. I think everybody's so focused on COVID-19 that a lot of people are kind of forgetting that other things happen.
Right.
I mean, people get bacterial infections, chronic diseases like diabetes and heart disease. Those don't just go away, and they shouldn't be ignored. People should be taking care of their overall health. We've done a lot of things in our clinics and here at the hospital. We have telehealth. You can actually have a visit with your physician from the comfort of your own home. We've put screening. We've done everything we can to make our clinics and our hospital a safe place for people to go and get health care. And they should use that. They should not ignore their health.
Okay, thank you so much. And thank you for watching. To keep up to date on the latest information and happenings, please like Salina Regional Health Center on Facebook, follow us on Twitter and Instagram.